Good afternoon, everyone, and thank you for joining us today. I was deeply saddened last night to hear of Maryland's first death due to coronavirus. I'm keeping his family and friends in my thoughts and prayers, and I ask that you do the same. I also learned this morning about the first pediatric case of coronavirus in Maryland, a 5-year-old who is a Howard County resident. We're thinking of them and their families during these challenging times. Coronavirus, as we know, does not discriminate. It is touching and altering all facets of life as we know it. And we are going to continue to see more confirmed cases and families impacted. We must do our part to flatten the curve and ultimately save lives. On Sunday, I declared a state of emergency in Howard County, and we closed the mall in Columbia, shops in Savage Mill, and our movie theaters. This was an important first step to reducing gatherings that was also followed Monday by the governor closing all bars and restaurants and gyms with the exception of restaurant carryout and delivery. Yesterday, we closed our county offices to the public, and residents can still continue to access many of our services online or via phone. We will now also be closing our park gates and our playgrounds to enforce social distancing. I want the Howard County community to know that our government is working tirelessly to keep our community safe and informed. This week, we're conducting conference calls with faith groups, community outreach organizations, businesses, and healthcare providers to address concerns and coordinate strategies so that we can all stay on the same page to serve. We've done several already, and more are scheduled. We're also coordinating with our elected officials at the local, state, and federal level, ensuring that we have access to important resources and advocating for relief legislation. Last night, I asked the Howard County Council to extend our local state of emergency and for it to remain in effect until further notice. And today, the governor shut down all enclosed shopping centers and entertainment venues and limited gatherings of 10 or more to people, and I applaud that action. We're united in a singular focus: public safety. And we're taking these steps for a singular reason, and that's to save lives. It is critical that our residents take these measures seriously. Please encourage your family members and your neighbors to do the same. That means you should avoid any group gatherings, play dates, or visitors to your home. By staying home and limiting your interactions with others, you are slowing the spread and potentially saving lives. Social distancing applies everywhere. Do not congregate in any public or private spaces. This means walking trails, basketball courts, playgrounds, and more. Please do not congregate anywhere. We need our community to check in on each other, keep themselves healthy, and most importantly, practice social distancing. That is the prescription that will get us through this challenging time. Call on your older neighbors, check in on old friends, and make sure they have what they need. This is the time for collective action, compassion, and kindness. People are shifting their schedules, canceling major events, and making huge personal sacrifices to flatten the curve. Howard County is a special community. We're connected by our resilience in difficult times, our generosity to one another, and our ability to unite around a common challenge. I want to thank the governor and lieutenant governor and all of our state elected officials, the other county executives and mayor. I want to thank our state and federal delegation, all of our local elected officials, my team, and every one of our healthcare and first responders who are rushing in when others are rushing out. And I especially want to thank all of you, because I know that this is a scary time, a time full of anxiety, but only together can we get through this and save lives. Thank you.
Good afternoon. I'm Dr. Maura Rossman, Health Officer for Howard County Health Department. Today it was announced that a 5-year-old in Howard County tested positive for coronavirus. The child was evaluated and sent home to recuperate. Given the time frame of onset, the child was not an exposure risk to children and staff at school. While this is the first case of coronavirus we have seen in a child in Maryland, we know that children, teens, and young adults are all able to get the virus. It does not discriminate, as the county executive stated. These are the groups whose outcomes from the disease are best. They recover more quickly, and their symptoms are often less severe. This is a sentinel moment that all of us should recognize. Anyone can get sick regardless of what country they live in, what state they live in, what county they live in, and what age they are. We must recognize that when children or anyone is sick with the virus, a larger concern is that they pass the disease along to seniors or those with underlying health issues. These are the groups who are more adversely affected, may require hospitalization, and may not recover as easily as younger ones. To protect everyone in our community, we must continue mitigation strategies. We can do this by minimizing the frequency of coming into contact with one another. We know that by limiting exposure, we will have fewer people getting sick. This is the time to stay home. In capital letters, stay home. As difficult as it may be, staying home for the upcoming weeks will help flatten the curve, slow the spread of virus, and save lives. This is the time to think about changing our usual routines, including how we purchase food and medications. Use delivery services if possible. If you must go out for essential supplies, use social distancing. Go at peak times. Stay at least 6 feet away from others in line to limit possible transmission. If you are older or sick, ask a neighbor or friend to shop for you and leave the package at the door. Continue to wash your hands. Wash your hands, wash your hands, and do it frequently. We know this is the single most effective way to prevent from getting sick. If you do not feel well, self-isolate and stay home. If your symptoms get worse, contact your healthcare provider for further instructions. Do not go to the emergency room if you are otherwise healthy and have mild symptoms unless advised by your provider. We want to ensure that those groups like the elderly and those with chronic health conditions have access to the emergency services that they need. These are unprecedented times. We must follow the guidance of our public health officials and government officials to have the greatest chance of reducing the impact of this virus. Staying home and restricting our movements beyond our homes will be difficult, but this is an opportunity for all of us to reconnect with our families, to learn how to use technology so that social distancing doesn't mean social isolation. This is the time to be calm, seek out credible information, and take care of our families and ourselves. Thank you.
Good afternoon. I'm Dr. Michael Martirano, the superintendent for the Howard County Public School System. Late this morning, we learned that a Howard County child was diagnosed with COVID-19. It saddens me greatly to know that this pandemic has now hit this close to home. We can confirm that the child is a Howard County Public School System student attending Elk Ridge Elementary School. However, to protect their privacy, we cannot reveal any other information. I have been in touch with Principal Mike Caldwell, who will be reaching out to the Elkridge Elementary School families, staff, and via an email, and has spoken with the family of the student directly. I have remained in constant contact with the Howard County Health Officer, Dr. Maura Rossman, who has informed me that there is no more risk to students and staff at the school than there is in any other students or members of the Howard County community. I encourage all of our families to continue to follow the guidance we have been sharing with you every day. Please know that the Howard County Health Department is investigating this confirmed case and will contact anyone who is at risk. Keep in mind, with 59,000 students, their parents and guardians, and thousands of Howard County Public School System employees living in Howard County, it was inevitable that this pandemic would directly impact our school system. I want to ensure our Howard County families, that is directed by the state of Maryland, and using products and techniques approved by the Howard County Health Department and the Howard County Public School System operation team that has been working each day this week to ensure that Elkridge Elementary School and every other Howard County public school and building is being thoroughly cleaned and disinfected. Staff members are taking all personal precautions aligned with protocols and guidelines that have been approved to disinfect all areas of the building that students and staff have come in contact with. I also know that this can lead to difficult conversations at home with your children. So we've also provided resources that can help you to have the conversations with your children. I strongly urge you to look through the resources in the parents section on the Howard County Public School System website. Specifically, we have shared the language that staff members used last Friday, to talk to students about this. This is an extremely difficult topic and an extremely difficult time. I thank you for all that you are doing to keep your child safe and the many efforts that you're doing to support your child. And as stated earlier by our county executive, by our health officer, I am imploring that all of our students stay home, take great heed in what is happening, and understand the significance of this event. Thank you very much. That's M-A-R-T-I-R-A-N-O.
Okay, we'll now open it up to questions. I apologize for not having a sign language interpreter on staff. If you are answering a question, please repeat the question before you answer.
How did that fall? Obviously, we have no time limit on how long this is going to be. Small businesses are closing, employees are losing temporarily his or her job. What do you recommend for not only Howard County, but all citizens to do? How do we support them?
So the question is about our small businesses. And our small businesses and businesses of all sizes are struggling. They're having difficulty. And those of us who are actually the workers in those businesses are struggling. I've been on constant communication, not only with other county executives, the governor and his team, and at the federal level, our federal delegation, and we are looking, and also our state delegation, we're looking at various relief packages and trying to come up with ways to help them during these challenging times. And that's why, as we're looking at different interventions, such as still allowing carry-out or takeout so that we can maintain social distancing, but still allow them to the extent possible to have a revenue stream. We have Larry Tweel from our Economic Development Authority who can expand on.
Thank you. I'm Larry Tweel. I'm CEO of the Howard County Economic Development Authority. And at the direction of the county executive, we have joined with the other agencies in the county that deal directly with businesses, specifically the Chamber of Commerce and Visit Howard County, our tourism office, to provide a singular resource for business information. Primarily, that business information was focused on workplace safety and employee safety. We are also now posting resources that are becoming available for business assistance. That website is at www.hceda.org. On the front page there, you can't miss it, there's a big button that will take you directly to that portal. We have been in communication with the Small Business Administration as well as the state's Department of Commerce, and we know that the governor has submitted the application to the SBA, and we expect that those resources, the disaster aid resources from the Small Business Administration, will be made available. We're hoping to get an answer before the end of day tomorrow. The businesses can create an account through that portal and be prepared for when those programs are made available to submit their application. Thank you.
All of us can't work from home. What's next?
So the question is, what happens for those who can't work from home? And I think we are transitioning to the extent possible for those who can telework. We're maintaining social distancing. We are continuing to look at closing some establishments for those who wouldn't be able to necessarily work from home. And we are evaluating policies in different ways that we can, for those essential employees, protect them to the extent possible.
You're closing parks and playgrounds. I understand playgrounds, they can get on the slides and all that. But kids still need to get out and get air and have a safe place to play. Is that something you might reevaluate? I mean, the park, they can ride their bikes there safely. There's a lot of space. They can keep distance. Is it maybe a little too much?
So just to clarify, and I'll also turn it over to Raul Delarme for details. What we've done is we've closed the gates to the park. And what was happening was we saw that people were using the gates to have multiple cars of people coming into the park and having these large venues. And that's just unacceptable. We need to make sure that we have much smaller groups. So yes, we definitely advocate for kids to be able to play outside. And before we were all going to these fantastic parks that we've invested in, many of us were riding our bike around our own neighborhoods. We've closed the playground equipment because, as you indicated, that those germs can stay on the equipment much longer, and we're not able to sanitize them after each use. So we definitely suggest and we advocate for kids to be able to get out and get some sun, kids of all ages. But we want to make sure that they are maintaining social distancing, and having our gates open actually was encouraging a lot of people to bring carloads and look at this as a spring break. This is not spring break. We need to take this seriously.
So they're still able to ride their bikes, let's say around the ponds in Columbia, and are there still places where they can play?
Raul?
Yes, my name is Raul Delarme, Director of Howard County Department of Recreation and Parks. Yes, our parks, people can still utilize the parks in regards to bicycling, walking the paths. All of our parks are still available for that. We're, as the executive said, we're encouraging the social distancing and really urging the people to practice that, because we've been witnessing a lot of gatherings, especially at our playgrounds, and that's one reason we are closing down our playgrounds for that reason. And also other areas, basketball courts. So we're trying to get the word out there to, keep your distance from each other, and, as the CDC and our health departments are saying. So if people would just practice that, I think we can continue to keep our pathways and other open space within our parks open.
So what is open?
What is open?
What is open to the public?
Everything except the playgrounds.
School playground?
No, I'll let Dr. Monterano speak on that, but I believe the school playgrounds and fields are closed, if I'm correct.
When our schools are closed, our fields and our activities and everything else is closed as well. Although we don't have gates on all of our schools, we are asking that our parents do not congregate on our school fields and any place where those activities would be, following the same guidelines that the county executive just has outlined for the parks. But we're also asking for individuals to self-monitor that, and to be very clear about why are we doing this, is to make certain we're adhering to the social distancing guidelines.
Okay, so Centennial Park is open?
Yes, it's available for people to utilize the pathways, walk around the lake, sit on an open space area. Again, we're urging everybody to keep their social distancing.
Can you say your first and last name again?
It's Raul Delarme. R-A-U-L, last name D-E-L-E-R-M-E.
My next
one of the questions asking about how our first responders are still handling, do they have their proper equipment? I'm Acting Chief William Maniszewski, Department of Fire and Rescue. Our responders are holding up pretty well. They do have appropriate PPE. We're monitoring our stockpile levels on a daily basis and reaching out to agencies where we feel we can pull some stockpile from if we need it. But right now, everything seems to be holding its own. Where this goes in the future, we're all uncertain, right? As of right now, so we're going to continue to monitor our stockpile.
Chief, spell your last name, please.
What? ANUSZEWSKI.
Thank you all.